Hello, everyone. Is it working? Is it working?
Yes, you're live.
Okay. All right. So I'm live now. Thank you, everyone, for coming to listen to this the third day of the Congress after so many presentations and wonderful speakers. It has been 3 days full of wisdom and the fellowship. And today I'm going to talk about this topic of the moral injury and how actually affects frontline workers, especially during the COVID-19 pandemic. So my presentation is going to be about 45 minutes to an hour, and because of the technology, if you have any questions, you can write them on the chat or send me a private message, and then I will reply to them after the session is concluded. Also, I will say that I had some problems with the connection earlier on in the day. I hope that that does not happen. If for some reason I get disconnected, I will reconnect again. So if you wait a few minutes, I will be back online. In a way, this is a presentation that has been on the making since the last World Congress in Dallas 2 years ago. And I will walk you through a few of the aspects of this new concept of moral injury as applied to mental health professionals. So a little bit about myself. Most of you know me from previous conferences, and I've been working with the Viktor Frankl Institute of Logotherapy since 2003. So it stopped?
For me, it stopped.
Okay.
Everything stopped. Yeah, continue.
Okay.
Yeah.
Yeah, so sorry about that. There was a little bit of a disconnection apparently. So get my sharing. I cannot see. Cannot share it. Sorry about the technical difficulties, because I just got apparently disconnected. Okay, I think I'm back in. Good connection.
Another instance, we can hear and see you.
Yes, yes, thank you. I'm just trying to put back the PowerPoint on my. I'm going to stop share, and I'm going to share again. I cannot do it. Can you see the presentation or not?
Oh, I knew she had it was okay. Yeah.
Everything looks good. We can see the
Yes,
PowerPoint very
but
well.
I cannot see the PowerPoint. I cannot pass the PowerPoint. I have lost my
You
screen.
can change your view, Edward, upper right corner there. Just click on view and change it.
Yeah, perhaps. Let me see. Speaker view. Exactly. Let me see. No, I still cannot see it. Okay. I cannot see my slides. That's the problem. Yeah.
Well, looks like you're not sharing your screen anymore.
Okay, so let's see.
So try sharing it again
Yes, yes.
and then go to view
Share
like
screen.
Charles said.
Presentation. Okay. Now I'm back on track. Sorry about that. This was a problem of the connection. All right, so I was presenting myself. I've been attending the Viktor Frankl Institute of Logotherapy conferences in Dallas since 2003. And then I became diplomat in logotherapy with the Viktor Frankl Institute and faculty of the Viktor Frankl Institute. We have been living in Ottawa, where we have established the Ottawa Institute of Logotherapy, basically to provide the local training. And recently, since last year, I've been a professor at the Graduate Theological Foundation. I chose the name of Viktor Frankl. This was a big thing to choose this name because it has a heavy weight to bear this name. I asked the Frankl Vesely family, Gabi and Franz Vesely, if I could use the name, and they actually agreed with it, and so that gave me a little bit more confidence. But anyway, so here we are, and we keep with my wife Maria Marsha, we keep working in logotherapy on a daily basis in my private practice as a psychotherapist, and in teaching and doing research. And part of the research, what is brought me to the concept of a moral injury. Okay, so the learning objectives for this presentation is first is to increase awareness of the definition and prevalence of moral injury among healthcare providers during the COVID-19 pandemic and beyond. Review the current guidelines for assessing and addressing moral injury, and propose meaning-centered interventions to manage moral injury and prevent the deterioration into a mental disorder such as PTSD. As I said, we have been preparing for these lectures for the past 2 years, and this has been our evolution with myself and my wife for the past 2 years. Initially, inspired by the last World Congress, we started to look at issues of burnout amongst healthcare professionals, also the concept of well-being, and how logotherapy can be of help. There was some logotherapy literature on the kind of things individuals can do to prevent burnout, even though burnout is also responsibility from the employer. It's a phenomenon in the workplace, so there is a responsibility from the employer. Now, the worker or the mental health worker or the health worker in general can do certain things to prevent burnout. Then the pandemic came. This Well-Being Through Meaning came out in March 2020. And we thought that therapists will need a lot of support and self-care. So at the initiative of my wife and I, we requested different therapists around the world involved in the Viktor Frankl Institute to send contributions about how they will apply logotherapy in their own self-care. And we were very fortunate that we got about 30 different contributions, and we edited this book called Carried by the Spirit, Our Heart Sings, Discerning Meaning Through the COVID-19 Pandemic. And there we collected a lot of reports on not just self-care, or how health professionals were coping with the challenges they were facing. And it was through the summer of 2020 when we were at the really difficult times of the beginning of the pandemic that we are still suffering from. And then last year I was teaching at a local university called St. Paul University here in Ottawa. And as I needed to prepare for the lessons, and I was teaching part of them lessons, logotherapy and meaning-centered therapy topics, I came across this concept of the moral injury. Here in Ottawa, we have the University of Ottawa and the psychiatric hospital called the Royal Ottawa Mental Health Center. And there we have the Center of Excellence for PTSD for the country, for Canada. Ottawa is the capital of Canada. And they issue guidelines for the treatment of for the assessment and treatment of moral injury. So I became very intrigued on this concept. And one of the interesting parts is that even though this concept has been around for some time, and there have been different definitions and guidelines that I will explain a little bit, it was not clear for researchers in the field how to treat it, because traditional treatments like CBT or exposure therapy were not really helping individuals who have been affected by this new concept of moral injury in healthcare professionals. Yeah, I'm saying new concept in healthcare professionals because moral injury concept has been there for a while in other contexts, as I will explain. So looking at the logotherapy literature, there's not much reference to moral injury, although there is some, especially applied in the military context. And there is actually an article in the International Forum for Logotherapy on logotherapy and session analysis for moral injury, which is mainly for the applied for the military personnel. But nevertheless, I looked into Frankl's books and I came across these quotes that reflects the approach I've been designing to address moral injury. Okay, so in the middle of his incarceration in the concentration camps, Viktor Frankl will provide counseling to prisoners, and within these sessions, this is the reflection Viktor Frankl made. They, the prisoners, must not lose hope, but should keep their courage in the certainty. So this is a part of the approach that I think will be important for moral injury, to keep the courage in the certainty that the hopelessness of our struggle, because Frankl was also struggling himself, did not detract from its dignity and meaning. So the hopelessness of the struggle did not detract from dignity and meaning. And what Viktor Frankl was instilling is this to keep the courage and the certainty. And we'll see how this relates to moral injury. So in terms of definitions of moral injury, there are different definitions. As I said, initially was defined in the military context. Moral injury has been around since ancient times. Even one can look at descriptions of the Iliad and the Odyssey in the Greek literature. One can find references to moral injury. Then it was in the 70s, after the Vietnam War, that some articles appeared in relation to moral pain or moral injury. What happened is that with the DSM-3 in the 1980, it was defined the term of post-traumatic stress disorder, and all the focus of attention was redirected towards the research in post-traumatic stress disorder. It was not only only until 2009 that it was observed that certain veterans, or many veterans actually, did not recover from PTSD with the traditional approaches. And we have, for instance, all the work of Dr. Southwick on resiliency and the use of logotherapy and session analysis in addressing PTSD with veterans that was actually trying to use alternative approaches for those veterans who were not responding to other approaches, like, for instance, cognitive behavioral therapy or exposure therapy or even acceptance commitment therapy. Now, the military context is different from the civilian context. Most of the people who veterans who experience a moral injury in the military context, there is a comorbidity with PTSD, post-traumatic stress disorder. Whereas in the health sector, even though there is an incidence of PTSD, it does not necessarily the case. So there are people, especially during the pandemic, that were identified suffering from a moral injury, but not necessarily from PTSD. And some of the research suggests as well is that the treatment of PTSD in healthcare professionals should be modified from conventional exposure therapy. So in terms of the Royal Ottawa, which is the Center of Excellence for PTSD, they joined forces with Phoenix, Australia, which is the Center of Excellence of PTSD in Australia. And they came up with these guidelines in 2020. And this was the first time I was exposed to the concept of a moral injury. So I'm going to adhere to these guidelines because as a matter of fact, after I deliver my lessons and Maria and I publish our book, there has been interest from the Center of Excellence for PTSD at the Royal Ottawa for me to offer a workshops on logotherapy and existential analysis. So it's scheduled now for March next year. The Center of Excellence will do the morning, talking about the concept of a moral injury, and then in the afternoon, 3 hours, I will provide a workshop on logotherapy and existential analysis for moral injury. And as I said, so this is the first time I have been invited to actually provide a workshop at the University of Ottawa since the time we came here 10 years ago. So it's not just about the usefulness of logotherapy, but also being able to help people in different areas and in the civilian context. So going back to the slide, so actions committed by the self or others that trespass moral or ethical principles. So this is interesting because ethics for me in the past was like a theoretical area that yes, one need to know the ethics or malpractice and to not to harm individuals, but being the ethics at the origin of some problems is like a new concept for me in the healthcare field. They had at least to admit it so openly. So as I say, it can be for self or others. So it can be that I witness somebody doing an ethical transgression, or myself, I commit an ethical transgression that I later might regret. Okay. This is in terms of failure to live up to one's own moral principles. And there will be some examples of how the COVID-19 actually led towards this failure to one's own moral principles. So, and then further with the definition is the psychological, social, and spiritual. And this is not a logotherapy textbook. This is the civilian University of Ottawa. That's a secular university. We are not talking about the Catholic University at St. Paul University. So the psychological, social, and spiritual impact of events involving betrayal by those holding legitimate power in high-stakes situations. So this was totally new for me. And as I read this, well, logotherapy and analysis has a say on this. And I think I've been proven right when we managed to generate this interest. So in terms of symptoms, as most of the literature is comes from the military, and Harold Koenig has been a doctor who has a research on spirituality and mental health. And he did extensive literature research, and he came across that there are primary and secondary symptoms of moral injury. So the primary symptoms will be guilt, if I regret an action I have done, shame in myself or in others, loss of trust in self on others. That's I find this a very important issue, because when we say loss of trust on self of others, can be loss of confidence, and also for in a religious realm will be a loss of faith in religious beliefs. So logotherapy, although it comes from the point of view of existentialism and philosophy, it can be very useful as well for chaplains. So here is where it comes as well in my role as a professor of psychotherapy and spirituality at the Graduate Theological Foundation, and actually I already developed a course that is available through the Graduate Theological Foundation, but based on our book, which can be useful for chaplains. Now, we are somehow building a bridge here as well to reach to other people who are not necessarily religious, or and in some cases antagonistic or against religion. You know, so, and then we look about a loss in sense of loss of meaning in life. So Harold Koenig already had incorporated the principles of logotherapy and existential analysis, but this is reinforced as well, that this is loss of meaning in life. Then as a secondary symptoms is more in the psychological realm. So these primary symptoms can lead towards depression, anxiety, anger, experiencing of the trauma, social problems, relationship issues, family problems with isolation of self-harm. So when clients come to us, perhaps they come to us complaining about secondary symptoms. And then we need to, through the history, taking the history, to need to see if there are any primary symptoms of moral injury. And that's going to be still part of the presentation when I will talk about what I call existential conceptualization, or having a general idea of the situation the client is in. So, as I mentioned before, the Royal Ottawa and Phoenix Canada identify certain stressors that might be leading towards moral injury. So among them, especially during the COVID-19 pandemic, having to make difficult life and death decisions to provide life-saving care when there is a shortage and the available resources are limited. So this is happening always in the news, the limited resources in intensive care units, or resources with the amount of vaccines, and shortage of hospital staff, and having to work extra shifts. So it's not just what we will identify as stressors that leads to burnout, but also there are stressors that are leading towards not being able to live according to one's own standards or own values. Other issues that have been prevalent during the pandemic is discharging patients earlier than they should be released from hospital to avoid the infection risk. So they did not affect the patients with COVID-19, affected by COVID-19, but also all the other hospital and health services that have been delayed or have been somehow put in a maintenance mode to be able to cope with extra demand. And then not being able to provide optimal care for all patients. So the triage, and we'll see how especially nurses have been affected by this problem. So the American Psychiatry Association was one of the first institutions that provided guidance for moral injury. So I think that was a ripple effect. The American Psychiatry Association in 2020, and then different centers of excellence issued their own guidelines, and this includes, for instance, the King's College in London. So I quoted this from the American Psychiatry Association. I found it was significant. Clinicians are expected in the course of providing care to make choices that transgress their long-standing, deeply held commitment to healing. So you will see that I will discuss a little bit the relationship between burnout and moral injury, because they overlap as we talk. All right, so just to give some data, because I mentioned in the 70s, there were some 2009 new rating scales started to appear. The new rating scales started to appear to measure moral injury, and the research started to be done, especially in the military context. And the Mantri, about 2 years ago, designed rating scale for healthcare professionals, so moral injury symptom scale for healthcare professionals. So this instrument has been used extensively in research, and there are papers coming out all the time. And actually, this paper came out after I submitted my proposal for this World Congress. It just came out a couple of weeks ago as an update of what's happening. So it's basically in this Duke University Health System at Durham, North Carolina. There's a group, and they work as well in collaboration with another group in China. So there are also papers coming from that group in China that are using the same scale. And so they measure with this scale healthcare professionals, in total 1,131 HPCs healthcare professionals. And they measured them in April 2020 and October 2020 to see if there were any changes. They also used the abbreviated Malash burnout inventory. And as you can see, in April and October, and there were no significant changes in the burnout inventory scale, at least in this group. And the average score in the moral injury symptom scale increased from 27.4 to 36.4 with a significant statistical significance. And of the whole sample, the healthcare professionals show moderate functional impairments from moral injury. Also increased from 26% to 45%. So that's a significant increase. Now, as these papers are coming out, we need to interpret what these numbers might be. First of all, not in all the samples we might see this discrepancy, but the fact that in this sample there was a discrepancy between the Malash burnout inventory and the moral injury symptom scale, it shows that yes, that there are two different concepts. It can be interlinked or can be overlapping, but we are talking about two different things. And if we don't distinguish those two different things, we might be missing in how we manage these kind of issues. And Mantri and his colleagues, what they started to speculate, and these are more experts than I am, is that perhaps a moral injury can be an antecedent of burnout. So we don't see burnout being manifested at the same time as moral injury, but we start to see first a moral injury, and later on, when they will do the follow-up studies, we might start to see an increase in burnout. So moral injury can potentially be a marker of burnout. Okay, that's an hypothesis that still needs to be tested. So going to similar concepts, but a little bit different from moral injury, is moral distress. You know, the concept of moral distress is used for situations in which healthcare providers are aware of what will be an ethically appropriate action, but they are powerless to take that action, either because that action is not possible to make in that situation, or because they feel powerless to take that action. Moral distress might become a moral injury in situations in which one's core principles have been violated. This is very interesting because when I talk about later on about the case conceptualization, it's an important decision to make as well in terms of the existential case conceptualization, as I will explain. Then we have a concept of burnout, a topic that we covered in a previous book, and this World Health Organization definition. The World Health Organization had to clarify in 2018 that burnout is not a new disorder, but a reason individuals can come to seek healthcare. So it's feelings of energy depletion, or exhaustion, increasing mental distance from one's job, or feelings of negative influence or cynicism related to one's job, reduced professional efficacy, burnout refers specifically to phenomena in the occupational context and should not be applied to describe experiences in other areas of life. So burnout is limited to the workplace. Now, moral injury is not limited just to the workplace, can be applied in other areas of life, can be family life or other activities outside work. And the same as we are talking about first the military, now the healthcare professionals, now their research start to come out in other professions. What about the legal system, lawyers that are, or judges that are listening to traumatic stories or listening to transgressions of the moral code? And what about teachers and education? So I see this as an evolving field. And now that we have measures that is going to go beyond the military and the health care system. All right, so in terms of the American Psychiatry Association, we start to look at a little bit how we can approach moral injury. Okay, so the guidelines that the American Psychiatry Association explains every effort should be made to identify and create solutions. So there's a creativity element, we will see later, creative values, which will allow healthcare workers to continue practicing medicine, I would say any other area of healthcare, always guided by the care ethical principles, first do no harm and to relieve pain and suffering. Okay, so in that way, what we look at, guided by core ethical principles. So the first thing is that even though we might have failed short of providing care at the optimal standards of care, that doesn't invalidate the ethical principles. You know, so the values are there, our ideals are there. What happened with moral injury is that there is a gap between what we believe and what we practice or how we can practice. And that gap is what might be at the source of the suffering. So how we can help individuals to diminish that gap. So here it shows a little bit how logotherapy and existential analysis might be applied in these situations of moral injury, but of course without explicitly naming it, specifically because there have not been research to prove the application of logotherapy and existential analysis in this area. But it can be a proposal to try out. So in terms of the guidelines, what they propose to help people in the hospitals is about learning about moral stressors and moral injuries, how the importance of ethics, you know, so it's not, ethics is not just a nice to have or something that one learns in school, but actually ethics becomes part of the therapy. That's the first time I see ethics is used as a therapeutic tool. Then using relaxation therapy, mindfulness, meditation to reduce stress, eating well, getting regular exercise, maintaining social connections and getting enough rest, supporting each other in the profession, seeking help if one is feeling distressed about what is going through. Okay, so I would say that in the Carried by Spirit book, where we had many therapists contribute, we have many of these elements of self-care in their own personal experiences. So that's also another indication of the application of logotherapy and existential analysis in this area. Okay, so we are coming to the last part of the presentation. We still have some time, you know, so the issue of the logotherapy and existential analysis conceptualization. Okay, so this is a case existential conceptualization. So before we can intervene or propose, we need to listen. Okay, so we need to listen to the client, but it's not just listening, taking note, but we need to do active listening, and that means be able to make sense of what the client is saying. So if you know our book, we have a book called Logotherapy Revisited. We describe 3 of these items, and the 4th item has been incorporated after reading material on moral injury. Okay, so in first place, we have existential vacuum, where the person suppresses or ignores the values, so they get into this state of apathy. Frankl described it as a neogenic neurosis, very similar to depression. And this can happen, for instance, when we look at burnout. And in burnout, we can see this phenomenon of suppressing values and just going to work without having the enthusiasm that perhaps that person once had when they started the profession. Then we have the phenomenon of existential distress, which we go back that there are some definitions on existential distress. And here we have the conflict of values. So the conflict of values, traditionally in logotherapy and existential analysis, has been approached to the point of view of the hierarchy of values. Okay, so what values are more important for you in your life at this moment, or which are the ones that are more important to live at this moment, and what are the ones that you can leave for later or are not so important at this moment. So conflict of values can generate anxiety for individuals, who I listen to, and during the pandemic, we with all the news that there have been conflicting news on how to respond to the pandemic, there can be a conflict of values. So we need to recognize, the issue of existential distress as different from moral injury, and also how we work through clients. Okay, so we look at the reliable sources. What are your sources of information? What is your particular situation? How you can face particular dilemmas in your life independently of the general population. How you respond to different pressure, for instance, from your employer. So that's the phenomenon of existential distress. And then this existential vacuum and this existential distress, even though we propose a logotherapy and existential analysis approach, it is a slightly different kind of approach. We first need to identify it, and for instance, when they say existential vacuum, is how we can rekindle the spiritual unconscious to bring about values in life. How the importance of values, and this comes as well from these studies I made on the principle model of the freedom of will. How to make choices, actually we need to choose our values. So how our personal values are going to influence or our choices on a day-to-day basis. So bringing that awareness of the importance of values to a person's life is a way of coming out of this existential value, where in the existential distress is more about the hierarchy of values. Okay, so if there's a conflict, for instance, the health, study, work, say, we have 3 different values, and we have health, study, work. Okay, so at a certain point in their life, perhaps a person might put more emphasis on work, other times on health, and other times on values. And that's going to be independent of which person. So we are not there to tell people what to do, but just to help them to become aware of what their options are, so that they can make more informed decisions. Okay, so for instance, we say, okay, so if you are working so much, this is going to deteriorate your health. That's an information that the client can use to make a decision. They might decide to keep working, say, well, I need to keep working in the respective of my health. Perhaps there is a higher value in there, or might be just a choice people make. Okay, or the same will be with education. So how important for a person's education is, it depends on as well the person's own value. So the important thing is not that they make the decision that we desire that they make, but they are aware of the different options they have, and then they can make a more informed decision. The third one, existential frustration and loss of values. This one I have come across a lot in my clients during the pandemic. Okay, so existential frustration, how I interpret it, and it's in the Logotherapy Revisited, is when a person is living their lives, is living according to their values, but then there is an interruption in their life projects, and all of a sudden it's as if they cannot live those values anymore. Okay, so say a dropout from university or from studies, no? So they value education, and all of a sudden that option seems to have disappeared from their life. So you can see how the multiple changes we had during the COVID-19 pandemic might have led to a sense of existential frustration. For instance, our ability to travel, to visit families and friends, or to congregate in closed spaces, go to visit people who are sick. So all those can, in appearance, lead towards this existential frustration. Okay, so how do I care for the elderly? How I visit friends? How I keep informed myself? How I keep interacting? So when we are in somehow a state of mind where we can reflect on this issue, perhaps with self-help, and we can solve it. But this the thing is that existential frustration, the same existential distress, existential vacuum, can be the origin, as Frankl said. It's not the cause, but the origin for psychological problems that actually are going to disrupt our reasoning and our capacity for self-care. And that's where an intervention from a carer or a friend, family, peers, counselors, or other health professionals or chaplains come in to help the person first to become aware of what's happening, and second, being able to provide a place of safety where they can start to make decision choices in what is available in their life. So here in existential frustration, this the attitudinal change. So we have the Socratic dialogue. So how through Socratic dialogue we can open up a attitudinal change to look at what is still possible. What not just what was lost, but what was possible. Again and again, here we will see in the interventions how the loss of value is a reason for suffering, because actually we value what is missed. So that is that's why Frankl was saying that the spirit is not ill, not sick, because we suffer existential vacuum or existential distress, existential frustration, because we have a spirit that is doing its work. Is doing the work that is actually signaling us that something is not right. All right. So saying this is what we traditionally had. I thought, well, there is something else in moral injury that it really doesn't. It's not captured by these three different conceptualizations. So there is a concept actually from the previous researchers, included Dr. Koning and also Dr. Pargeman, who is a psychologist who actually does research in spirituality and mental health. And they use the term spiritual struggles. Spiritual struggles. So, but there is in the religious context. So spiritual struggles, they refer when somebody who is religious and have faith, their faith is not helping them to develop resilience or growth, but actually is a source of pain. For instance, all the issues of child sexual abuse in the church, or when there has been some kind of betrayal in the schools. In Canada, for instance, the residential schools. So the spirituality in that way can be a source of a struggle. So that's a spiritual struggle. Now here, we are not necessarily talking about religion or the loss of faith in God, but also loss of confidence in oneself and loss of confidence in others. And instead of a spiritual struggle, I found that a more appropriate term will be an existential struggle. An existential struggle which can speak to the religious and the non-religious, or to everybody. So there's where I can present this in a non-confessional environment, in a secular university. So we're not just talking about spiritual struggles, because that's the department of the chaplains, and they have a chaplaincy service. But we are talking as well about existential struggle. It's a lack of trust in the system, lack of trust in the managers, in colleagues, which is the same kind of phenomenon, but in a different context. So in this existential struggle, in terms of the axiology or the values, ethics, is what has been described in the literature as a moral transgression. So we in logotherapy and existential analysis can talk about values transgression. So when I have beliefs, values, how things should be, how my family should be, how my partner should treat me, how the hospital environment should be, how the life should be. We might experience a transgression of our own values. And also, these values transgressions can be in terms of the natural disasters like the COVID-19 pandemic. So because it's not about that the COVID transgreded our values, but it's how people responded to the situation. So how we support each other, or how there has been a loss of value in one's own life. Okay, so it's not just a loss of value, but also that has led to this value transgression, that I cannot live according to certain standards. So if I say I used to visit my elderly mother in the nursing home, okay, oh yeah, but now you can use the Zoom. Still, there's not just a loss of value, but there can be also a value transgression, because I'm not providing the quality of care I wanted to provide to my relative. Okay, so we are not going to see these four domains in isolation, but they are going to be mixed with each other. So we're not thinking that we're going to see a clear existential vacuum, existential distress, existential frustration, existential struggle, but they are going to be mixed with each other. And I think one of the works of the therapist is to untangle, to become aware of the different dynamics of the spirit, to be able to approach the situation accordingly. Not to approach every situation as if it was the client is suppressing their values, or there's a conflict of value, there's a value, or there's a values transgression. So the same situation can lead towards these different distinctions in the no dynamics that Frankl people talk. All right, so conscious of the time, I have 10 more minutes. This is the last slide. And this is about logotherapy and existential analysis interventions. Okay, so this is what is the proposal. Okay, so we have some research done in the application of logotherapy on moral injury. Osram is the author, and we have an article in the forum. And what these authors did at that time, it was in the military context, was they did a combination of a transpersonal psychotherapy and some principles of logotherapy and existential analysis. And in their approach, it was about when there is a situation of trauma, or there is a specific situation of moral injury, to look at the strengths of that individual. That individual, in spite of their shock, they managed to take a peer to an aid center, or in spite of their shock, they managed to help a person, or in spite of their shock, they kept cool to somehow defend themselves. So within every situation that is traumatic, perhaps the soldier exhibit a heroism in their skills and in their strengths. And then they say, okay, if you have those strengths, how we can build from those strengths towards the future. Okay, so that was their approach. Now, even though that's a very good intervention, what we are looking at the logotherapy and existential analysis, it goes a little bit beyond this concrete situation, because sometimes in the moral injury in the healthcare profession, we might not identify a specific situation of that particular patient or that came through the emergency room, or but it's more an ongoing micro trauma, an ongoing process of not having resources, or managers trying to manage in a way that is not compassionate. So everybody's trying to do their best, but at the same time, we are doing our best. We are not following the higher standards of care that we would like to offer to our patients and to the people who are in our care. All right, so saying that, okay, so what elements of logotherapy and existential analysis we can use for moral injury? So we have to first identify inner resources for self-distancing and self-transcendence. So how we can look at how the person can reflect on what happened, and how the person can start to look beyond of what happened. Okay, so not just what was lost, but also about the possibilities. Okay, so how the person is suffering because they are not doing the things that they would like to do them. So to recognize that, and that's a source actually of their strength. Because what will be difficult is they will be indifferent. If they are indifferent that they cannot provide the care they should want it, they will not be suffering from moral injury. But actually the fact that they are suffering, that's points to their inner resources to reflect on themselves and their capacity to look at the possibilities. Because they always to do something is better than do nothing. Second, they discover areas of freedom to respond to every situation. So again, this we need to affirm, as the third point talks about, affirm the universal values embedded in the healthcare profession. So all the values that we learn and we keep learning, they are still valid, even though perhaps we cannot live them. Okay, so how in that particular situation I can still live those values, considering the limitations I have in life. Okay, so and then where that freedom comes from is at first that we are choosing those values, and we are choosing to do the best we can with those values in a particular situation. Okay, so this is not to take responsibility away from external factors, but also for the person to be able to come to terms with what is happening with them. Second is discern the values transpiring from emotions about events. I must say that I became more aware of this through what's called acceptance and commitment therapy. Okay, so there has a lot of similarities, acceptance, commitment therapy, and logotherapy, in terms that it talks about living about a life I value. Okay, the thing is that in moral injury, there is no acceptance. If I cannot provide optimal care, I don't accept that. I don't bargain that. I want to keep my ideals. So I'm not accepting. Yes, I recognize that I'm in a difficult situation, but actually I want to improve the situation. Okay, so what I learned from them, they make it very explicit, is that when we are affected by something, when we have an emotion, that emotion has an underlying value. When we are saying, if I suffer because something is missing, I suffer because I'm conflicted, I suffer because I'm struggling, or I'm anxious, or I'm feeling anger. I have so anything that express emotion, it has an underlying value. So that's another way as well to tap in to the value world of the person. Otherwise, it's indifference. So and that's interesting, because in some research in moral injury, I don't know if it's in the healthcare, but at least in the military, they say, well, people who have psychopathic traits, they don't suffer moral injury. Okay, but the conclusion cannot be, okay, so let's all be psychopathic, so we don't, that will be a wrong, or a fallacy, or a wrong argument. Actually, what we want is to have that attentive, meaning sensitivity, and be aware of our emotion, understand where they come from. And as we understand where our emotions come from, and then that gives already a source of healing. And finally, we know all this from classical logotherapy, the 3 avenues to find meaning in life. So find meaning through creativity. APA, American Psychiatry Association, talks about that, how we can be creative, and nurses have, especially nurses and doctors as well, but all healthcare professionals, they have come up with very creative ways to care for people in intensive care units and hospitals and the different facilities. All that is in our book, in the LTEA for moral injury, for the management of moral injury. Experiential, how the peer support is so important as well. You know, how supporting each other, and also the responsibility of the employer to support their employees, so that they have a space where they can talk and they can share in a confidential way their suffering. And finally, the attitudinal values, that is about, so what is it, how I can respond to the situation. Okay, so this can be at the individual level. You know, when we, as a clinician, I mostly work with the individuals and groups, but also this concept of moral injury has a political ramification, which elevates the political debate. You know, so we can have a debate, a political debate to the bargain, or to the law, you know, to sales, or we can elevate the debate in terms of talking about values and what's important for the healthcare workers, and what's important for the clients, and also to have a point of view that at the end of the day is the clients we are serving. You know, so it's if we have healthcare professionals that are well treated and are well cared for, they are going to provide better care for their patients. Okay, so this I have a bibliography, the slides available. I will make these slides available in the Congress website. And there might be some questions. And I said, if you have any questions or you want to collaborate with us, because my plan is that I'm going to present a workshop at the Royal Ottawa Hospital, and then to see how we can collaborate with the Center for PTSD to start to design some studies to test the approach out. Okay, so we have very good examples coming from the palliative care, the Dr. Braybar's work in New York, that is possible to design studies to ascertain the validity of logotherapy and existential analysis. So that's our first step, to start to do this collaboration with the University of Ottawa and with the Center for PTSD, and now the appended PTSD and moral injury. Okay, so thank you very much for listening and for being patient with me at the beginning with the technical glitches. And I hope that you have a wonderful afternoon and or rest of the day where you are in the world. And this presentation is going to be recorded, so it can be a good reference. As I said, there's very limited literature on this area in logotherapy and existential analysis, so this is going to be a resource for future research, this presentation. And I hope that in 2 years' time we'll have more clarity, and perhaps hopefully we'll have as well some research data to see if this was really worthwhile endeavor. Thank you very much, everybody, and I wish you well, and we'll keep in touch. Bye-bye then.